Good morning. Good morning. You're welcome to today's lecture. Today, we take a look at AUM 221. AUM 221, actions and uses of medicine. Wait, you say what? Child. Child. Okay, you're not with your AUM. You're not with your AUM notes or what? All right, today let it start. All right. All right. So let's continue from where we stopped. Yesterday we introduced routes of drug administration, and we define and explain what routes of drug administration means, and we stated and explained in detail factors that influence choice of what routes of drug administration. Okay, so today we also went ahead to discuss, outline those routes, right? Actually, yesterday I told you about enteral and what? Parenteral, right? Actually, that I made mention of local, systemic, and local routes, right? If you can remember. Actually, what happened is that that's enteral and parenteral. They are under systemic routes. How to get that? They are under what? Systemic routes, because either of them must find its way to what? The what? Systemic what? Circulation. Find its way to where? Systemic circulation. Even though some may have a bit, maybe the one in the buccal cavity or sublingual, even though yes, mainly buccal cavity, depending on what you want to achieve, may have some contact with that particular area, but majorly is in what? They are mainly what? Systemic. Now, we have those that are focused mainly on local what? Routes. So basically, you can do it this way, that route of drug administration divided into two: systemic route, sublingual, buccal, and what again? Rectal. Now, under what is it called again? Under the parenteral, I listed them yesterday. What are they? What are they? Parenteral. Okay. We have the injection route, right? Good. Under the injection route, we have many of them, right? Okay. What name the routes under injection route? Sublingual. You know where that? Messi is confused. Child. Only one I want now. Okay, I have to continue. Intratech, I agree with you. Intra what again now? Continue. No, international is not. It's under local. It's under what? Local. So these ones are on now. We also have apart from the what is it called? Apart from the those that are those that are concerned with the injection routes, we have others that are not actually injection route, but they find drug through that means can find its way toward the systemic what circulation. We have things like transdermal. Altogether, transdermal. We have things like what? Transdermal. And we also have, aside transdermal, inhalational is somehow, inhalational can still have systemic at the same time local. Am I communicating? But it's more of local than systemic. Altogether, it's more of local than what systemic. So you sometimes you can see it under systemic and also see it under what local. Depending on what you want to do, what achieve. Depending on what you want to do, what achieve. Okay. So now let us now go. Let us now list those under local routes. Under local route, we have topical. The skin, right? Skin topical. We have intranasal is there. We have ocular is there. Ocular is where? Optic is where? Optic is where? Ocular is where? Ocular is nose. Wow. Ocular is where? Eyes. Okay. Optic is where? Optic is ear. Okay. Optic is eye. Ocular is eye. Wow. Optic is where? Ocular is where? So you also have those through we have vaginal route, okay? Depending, of course, you know the one that have vaginal rights. Paisley rights. Paisley is where? Vaginal right? Hope you know. Good. It's local. Okay? When I say something about the mouth, there are some you put in the mouth. The target is to take care of what is happening in the buccal cavity, not for you to go and start entering systemic what circulation. Maybe there's something you want to take care of in the mouth. Mouth is also there, oral is also there, but not. Oh, well, if you say oral goes deep to entering the what stomach. Am I communicating? Of course, it will enter the systemic what circulation. But when you say mouth, your target or buccal, your target is that place. Why you have mouth or buccal, the answer is that there are some buccal that we also find its way to what systemic what circulation. There are some of the routes you see in local. You also see them in where systemic. Am I communicating? So please note that point so that you don't see this one here and become confused. But why is this one here and this and also there at the same time? Okay. Things like inhalational. I think I mentioned it that inhalational has go towards systemic and even transdermal. Transdermal also has systemic and what? Transdermal also has systemic and what? Local. Now, by the time we pick the one after the other, then we understand better. So this is just the classification. What I just did now is a classification of what? Routes of what? Drug what? Administration. We defined it. Please look at the key points we have looked into so far in route so that this is to guide you in your study. we do define what routes of drug administration, and we explained it. You may just be asked, what is route of drug administration? Just not define and do what? Stop. You define and do what? Talk about it. Tell me what you know about it, not just define it and run away. You have a mark of someone that define and run away. So you have to explain it. Am I communicating? So I'm giving the key point on what we have discussed so far. We have defined it, say one or two things about it. We also talked about the factors that influence the choice of routes of drug administration. We have also classified routes of drug administration. So we now want to go deep and take them one after the other. That's what we want to do now. That's what we want to do now. So now let's start from different routes under the enteral part of the systemic. So now let's go to the routes under the enteral part of the systemic route. So under the first one, there is the oral routes. Oral routes. So this route is the oldest. Are we together? This route is the oldest and the commonest mode of drug administration. Is the oldest and the commonest route of drug administration. One good thing about it is that it is safe. It's safe, right? It's safe. In fact, if you take something orally and something bad happen, you can stop it immediately. You can even induce emesis. You know what emesis is? You may induce to vomit. You may induce vomiting, and person will do what? Vomit that whatever that has entered. Unlike injection that once you put in, to be able to may not be that easy. So it is safe and is what convenience. It's convenient, even though there are people that are naturally do not like anything drug. But in general, you don't need any assistance. In general, you don't need any assistance. Except for kids. But once you have come up of age, you can do what? Take the medicines on your own, and it's not invasive. You know what I mean by being non-invasive? It's non-invasive. You don't need to inject or pierce any part of your body because you want to take medicine. You don't need it. Okay? Some people are needlephobia. Some people are needlephobic. Sorry. Some people are needlephobic. Once they hear inject, they will disappear. So, but this one, you don't need all those piercing, whatever. So, and because of that, it's often painless. It's often painless. Okay. And one thing there is that it is cheaper. The cost is not that, at least the cost is not that much to compare with other. One small injection. In fact, most of the injection that will fill 1 carton, you know how much it will be to compare with tablet that will fill 1 carton. I'm not complicating. And not only tablet, even syrup. If you get some syrup, a carton of it, get injection and some injection and fill it, it will be almost 10 times the cost of that one. Am I communicating? And also, if you want to, for you to, because someone need to inject you, or maybe other route like transdermal or whatever, the service charge must be there. 3 of us to compare with tablet you just buy or syrup you just buy and do what? Take. All right. So now, the next thing I want us to note there is that the drug itself or the medicine must not be sterile. It mustn't be what? Sterile. It must not be what? Sterile. Unlike some that, in fact, anything that is entering the bloodstream must be what? as indirectly must be what? Sterile. And entering the eye must be what? Sterile. Entering all these things that will have contact with the mucous membrane, and all these what is it called? All these mainly entering the bloodstream directly must be what? Sterile. And you see ophthalmic, but by the time we treat isotonic solution, I'll talk more on some of these drugs that must be isotonic. At the same time, they must be what? Sterile before you can do what? Use them. But what you put in your mouth, enter the stomach, don't need to be what? Sterile. You know, there are a lot of things that it will pass through. Some will even take care of the whatever you think is there, even though it will eventually enter the what? The bloodstream. But before you get there, you know what would have changed in the what? In the what medication. Am I communicating? Unlike the one that's entering straight into the what? Bloodstream as in the heart. It can cause sepsis and other issues. So it must not be what? Sterile. But that doesn't mean that you should allow it to be laden with bacteria, because they say that it must not. If you load it with bacteria, you don't care how clean where you are formulating is. Sorry to let you know that your patient may end up being infected. Am I communicating? The point is that it should be clean, but not when you say that something is sterile. What it means that there is no pathogen, no atom, is none should be there. That doesn't mean being what? Sterile. It must be prepared in an aseptic, using aseptic procedures. The environment, everything, water you use must be sterile. Everything you use there must be sterile, must be sterilized. That's the meaning. To remove any, not even one or two. But in order, you don't need, but it should be clean. The environment should be clean, but not dirty. That's the point I'm making. All right, so okay, and the dosage forms we find under this route are mainly solid and what? Liquid what? Dosage form. Under solid dosage form, we have dosage forms like tablets, powders, capsules, granules, and what have you. Under liquid dosage form that can be administered through this route, we have things like elixir, syrup, emulsion, and mixtures, and many of them. Am I communicating? So, drugs formulated in any of these forms can be administered what? Through oral what? Route. Are we together? Okay, now we've been pointing out wonderful things about this what? Route. It also has its own issues, limitations. You know what we call things are, if you understand. At this level, I must not come and start saying the advantages and aside these advantages. You go and cram it. Sometimes I want you. You can, if you read it, understand it, you can on your own point out what and what are the merits in the words write up. Okay. So I must not come and tell you advantages of tablet, advantages of oral route, and I'll list it for you. Then disadvantages, and I'll not list it for you. You now go and gram it. No, you have to read it and understand it. Sift it out yourself. That's when it retains more. Am I communicating? So you don't need to be told that what I've been discussing since are the what? Advantages or the merits. Okay, merits. Now, okay. In as much as we've been talking about beautiful things about this route of drug administration, there are some issues. Remember what I told you in your first year about limitations of dosage forms and other things. That doesn't mean that this one is bad or good. Instead, it's an edge. When you talk about merits or advantages, to talk about the edge this one has over this one. And when you talk about limitations, demerit, disadvantages, we talk about the what? Where this one may not fit in, and I can do what? Fit in. So this is what I want to talk about now. There are some situations whereby oral route will not give you what you want. You have to look for other route that will give you what you want. Such situations are as follows. Now, number one, there's some drugs. There are some drugs or there are some situations whereby you need emergency response. Am I completing? You need emergency response. You have no business with oral medications. Am I completing? Even though there are some that can you can okay, it's sublingual that can do that anyway. But good. So oral, you don't if patient, please don't even think of oral. Go into something else. If the patient, if you need instant, maybe patient was rushed was rushed to the emergency unit of your hospital, then you can start opening his mouth and be giving tablets. You're wasting your time. You're wasting your what? Time. You need instant what? At least to stabilize the patient before you go into what? Oral. Okay, now, so in such situation, you do not use what? Oral. Okay. Now, another thing there is that another issue that there is that in oral, it's not good for what? Unpalatable what? Drugs. Drugs that are not what? Palatable. You know what I mean by palatable now? We discussed this, right? Right? Who said no? It's not true. Don't deny me. We discuss what is palatable, right? And what is not what? Palatable. When they say that your food is palatable, what does it mean? Eh? It's what? Good, delicious, and you can tolerate it, right? But when you thought it's not palatable, maybe it's bitter, or it smells somehow, right? You can't even bring it closer to your mouth. I'm not getting in such situation, although they mask, but most time, even if you after masking, maybe by coating or by masking using flavor, but even at that, some even after masking, you still have the what aftertaste. After you know what aftertaste is. After taking something, you start feeling that's when you now start enjoying the real taste. But when you are taking it, you will not feel it. Then if after taking it, you will now start enjoying the real taste. Will you take it again tomorrow? You run away. So, but the point there is that such drug may not be good to be formulated as what in that part. Some like chloramphenicol may not be good for that. Am I communicating here? So, are we together? Are we together?
Yes.
Ask.
So I thought that this chloramfenicol is
White capsule. So, what about it? Have you done it before? You put it in your mouth.
okay.
It's capsule now. That's why it's encapsulated. At least to limit it. That's why remember when we did capsules. See, anything. See, I keep saying this. Anything, anything you see us telling you when you're first year, is not. It doesn't end in first year. It's continuous. You keep applying it. You keep going back to those things. Remember when we discussed capsule in the first year, we are talking about reasons why you formulate in this dosage form, reason why you encapsulate. We said that capsule is used to do what? To remind us what we discussed about capsule. Mask what? Good. So that's why it's not capsule. Have you put it in your mouth? Try it. Let's see. Tell us the results. But not when you don't need the drug anyway. Am I communicating? Please, let's continue. So irritants and unpalatable drugs cannot be administered using what? Oral route. Okay. Now, absorption of drug may be what? Variable. Because so there are a lot of things going inside the system. In fact, there is no all we know on the general in general, you can simply say, if you take this medicine, it will break down and reach that active ingredient. Wonderful, within so time. But there are other things that may be happening in your system. You know that human physiology, human body changes. A lot of things can make your physiology to change and come back to normal. Am I communicating? It may have to do with what is going on in your gastrointestinal tract at that point in time. And if you take that drug, it may not give you the absorption you are looking for. That will give you the maximum therapeutic effect at that point in time. But there are some time you take it to go well. Am I communicating? There are factors that may be different factors that so absorption there is varies. There is no there's no hard and fast rule that if you take it, all of them will take place. We will be absorbed at the same time, absorbed at the same extent. It's not possible. And even in the same person, it may also vary. So absorption may do what? Absorption may vary. If it varies, and sometimes it may not give the bioavailability required for the maximum, at least optimum therapeutic effects. So that's why I say that absorption may be variable. Of course, I've told you about not being hospitable for unconscious patients. Is it all the emergency? Is it all the how do I put it that? Is it all the emergency situation that will help that patient will be unconscious? Eh? Okay. So unconscious patient, all unconscious patient, they are can we say that they are in emergency situation, but not all emergency situation. Not all patients that are in emergency situation are unconscious. Okay, so with that now, I can also tell you that this route is not good for unconscious patient. Two of us, I think we discussed that yesterday. So it's not for unconscious. So if the patient is unconscious, you look for another route that will still deliver the same drug. That's the beauty of the dosage form. You want to deliver a particular drug to a patient. Let's assume you want to deliver paracetamol. Paracetamol is the drug itself, right? And you want to administer paracetamol. The patient is okay. The patient just come to the pharmacy on his or her own, came there, get the drug, pay, walk majestically, even can't walk himself, and go home and take it and go and sleep. Maybe the patient has headache. That they carry the patient, and the patient's fever is very high. The patient's fever is very high. One, the patient is unconscious. Very high fever. Unconscious. We will go and give paracetamol tablet. You give injection, right? Because one, you need immediate action. Two, the patient cannot even open his or her mouth to swallow the tablet. Because of this reason, you need the injection. True of us. In fact, in some situation whereby the injection may not will work, you insert suppository. Am I communicating? Now, then look at this situation. Now, the patient walks in, he's conscious, but his fever is very, very high. Very high fever. Will you give the tablet? There and then you may give one dose for a start to bring down the fever, right? Then, because that fever, if it's too high, can cause other things in the system. Then you can now give tablet, the patient can go home with and continue with the tablets. Am I communicating now? So now, I don't see the difference between being unconscious and the emergency situation. I just use it to explain that so you don't get confused when you get there. Now, this particular route is not good for drugs that can cause gastric irritation. Do you agree with me? Do you agree with me? Do you agree with me? Yes, it's not for some somewhat drug that can cause gastric irritation. What's that? Okay, thank you. It's not good for some drug that can cause gastric irritation. It's not good for such drugs. because if it gets to the stomach by and have a contact with the gastric mucosa, it can irritate it and you become very, very uncomfortable and can lead to other issues. Am I communicating? So it's not good for, so even though yes, they try to coat, but it will still break down. The drug will still do what? Irritate it. So it's not good for such what? Drug. Are we together? Now, it's not good. You did first pass effect, right? In your in your 122. Good. Some drugs that are susceptible to first pass effect is not good for such what drug, because remember I told you that everything that enters the stomach will find its way to the what? Liver. True or false? And that first pass effect takes place where? In the liver. So if the drug itself can be destroyed by the metabolic effect in the liver, when it passes there first before getting to the systemic circulation, it will have issues there. It will get a percentage of it will be destroyed, and when that is done, bioavailability will do what? Reduce. And if bioavailability is reduced, therapeutic effect will be what? Reduced, because it's only those that are available in the systemic circulation that will be distributed to go and exert their what? Effect. True or false? True or false? So it's not good for drugs that have first pass what? Effect. First pass effect. Okay? Then another issue there is that because of presence of food, we have an interaction. We have drug interaction. We have drug food interaction. Because of presence of some food in this, maybe the nature of food you eat, or you ate before taking the drug, or after taking the drug, can have effects on the drug. So there are some drugs that interact with some foods, and not just food, even gastric motility can also affect absorption of drugs. Now, because of that, some drugs may be affected by presence of food. For example, now a drug like for example, now tetracyclines, and even penicillin, when you take your tea in the morning, you take your tea, right, with your milk, or you take milk alone, and you go and take what? Maybe you are on tetracycline or any of these penicillins. You go and take milk. You take what? Immediately after taking your tea, the milk is still there. You go and take what? These drugs, tetracyclines, and the what? Penicillins. What will happen to is that their absorption will do what? Will be slower. The absorption will be what? Slower. The milk will slow the absorption of these what? Drugs. Tetracyclines and what? Penicillin. And it's not a good thing. The absorption should go the way it should. True or false? So if you must, the best thing is to avoid those things and finish your treatment. Your milk and your tea, they're not running away. Am I communicating? When you are done, you can continue with your medications. That's the best thing to do. Now, for those that have, of course, you know that this work I call that the antibiotics. Good. For patients with hypertensive patients, or those that have other cardiovascular issues that are on propranolol, this bioavailability of propranolol is very high. Is very what? High after normal meal. Just if you eat normal, if you eat before taking propranolol, the rate of the bioavailability will do what? Increase. But the point there is that if it increases, it's a good thing, right? Right? But sometimes you don't need it to offshoot. Am I communicating? Because depending on what you are trying to control, it may go higher than they require this. Am I communicating? So that is also an issue. Yes, under normal circumstances, increasing the bioavailability can help is a good thing. But what if it increases and become, the more they appear in the bloodstream, the more their effect will be. Even their side effect will, the more their side effect, hope you know, the more their side effect. Under normal circumstances, without food, it may be absorbed at a normal rate issue, normal extent and rate issue be absorbed. But when there's presence of food, it may offshoot. And these things, we call it control, blood pressure control, not blood pressure how do I put it, treatment. You are controlling it. If it goes down, so down, you bring it up. If it going up, you don't need to allow it to do what go up, so you bring it down. So this is what you keep doing for patient that has BP, diabetes. This is how you keep going about it until it will maintain normal range. It should what? The anytime you fail to do the right thing, it may do what? Offshoot and cause problems in the body of the what? Patient. It can even cause stroke. Don't worry, when we go, okay, that should be a final year. When we go to cardiovascular system drug, we'll discuss that. I don't know if I'm really want to take you on that. Because I didn't even know that I would want to take this one now. So when you have fatty meal, you know what fatty meal are, right? Fatty meal. When you have fatty meal, drug antifungal like griseofulvin. Do you know griseofulvin? Do you know the brand name you call fusin? Fusin. That's the, I think that should be that's the one in the people's lips. I think that should be the innovator brand, if I'm not mistaken. Fusin. The brand name is Fusin, but the generic name is what? Griseofulvin. Griseofulvin. That's the generic name. Grisio is an antifungal. Now, the point I want to make here is that griseofulvin, after a fatty meal, its absorption is higher after a what? Fatty meal. So, fatty meal can also affect the absorption of what? Grisio. Have you ever seen this? Why this thing has issues? That if they remember what I said, good, the higher the amount of drug that appears in the system, the higher is everything that goes with that drug. Hope you know. The higher the activity, the higher the effect, the higher the side effect too. Are you aware? Are you aware? Yes. The higher the dose, the higher the side what? Effects. So that's one thing with not letting amount that appear in system to be too higher than the normal amount that should appear in the system. So that's why it's a disadvantage. Even though in some situation it may be a good thing, but on a general ground. Okay. So, all together, I understand what first pass effect is, right? I've explained it in detail in different occasions. So if you are asked to write short notes on first pass effect, you can do that. You did it. You did it in your first year, right? Please go and revise what you did in first year on first pass effect. Revise it again, please. Let us not waste time there. Now, I've listed dosage forms that can be administered through the what? Oral route, right? So if I ask to write short notes on oral route to oral administration, I believe you can give me up to 2 pages. Yes, we have spent up to going to 10 minutes now explaining this, 2 of us. So it's not just like that. You should be able to give me 2 pages, loaded 2 pages. Okay, if I ask to discuss extensively oral routes of administration, you can give me 2 loaded, not pages with nonsense, but fully loaded 2 pages with points, examples, and illustrations. You can do that. I believe you. You can do that. Now let's go to the next. Let's go to the next route under the enteral part of the systemic route of what? Drug administration. Okay. Of course, can you use oral this thing for patient that is vomiting? You cannot, right? So you should know that by now. Okay. Vomiting, oral. Sometimes you may even give that promethazine. You vomit that promethazine unless you give injection. Sometimes you may even vomit the promethazine. You there's level per patient will be anything that enters the mouth is coming out. Don't waste your time. There's level the patient will be anything that enters the mouth will come out immediately. Not immediately. The test here you hear immediately, not even tomorrow. So don't even try it. Just look for other this thing to administer the medication. Now let's look at sublingual slash buccal. Okay, so of course, when you hear sublingual, what it means is that it's under the tongue, that the medicine is placed under the what? Tongue. Please note that point, okay? But when you hear buccal route, or is placed where? Between the gums and the lining of the what? Cheeks. Lining of the cheek. Between the gum here. The gum of your teeth. Gum here. And lining. All together. So why do we place it there? We place this thing either under the tongue for sublingual, or in between the gum and the lining of the cheek, for this reason, so that the drug can do what? Dissolve and be absorbed directly into the small blood vessels. This under this tongue. Have you noticed that if you raise it, you see red line, that near blood, tiny blood vessels, small blood vessels, so they can be absorbed through that what? Blood vessel and enter the what? Circulation. That's why they are placed under the tongue on this thing. The what is it called? The cheek, the lining of the cheek, between the gum and the cheek. Now, in other of the cases, the drug is absorbed into the what? Circulation, basically through the mucosa. These things are aligned by what? Mucosa. Hope you know. So in other cases, the drugs will do what? Enter the what? Systemic what? Circulation. In other ways. Are we together? Are we together? Okay, now another point I want us to note here is that, so when do we now use this? What edge do you think this has? From our explanation so far, what edge do you think this has over oral route? I want to hear you out now. I have been rapping since. To tell me now, what edge do you think sublingual slash buccal have over oral route? Brother has first pass. I agree with you. Any other one? Any other one? I agree with you. Any other one? I agree with you. And is it okay? Okay, I use kami. I agree with you. Any other one? What of those that can be? unconscious patient that is hypertensive, that if you can open his mouth, there are some that you can't even open your mouth. Eh? No, the point is that if you can open the mouth, that's the other issue. If you can, wonderful. To place it under the tongue. Once you can, if you cannot, but if you know there are some conscious like that you can't even open their listing. Hope you know. But there are some that the mouth will be open. So the one that the mouth is open, if you put it, you may leave where you should go and start entering another place. So these are things you know. There are some things decisions you make by looking at the patient there. You call it evidence based. You see, this is what is happening there. You are taking care of it immediately. Am I communicating? So I like it that you're listening, but the point is that what is on ground, will you be able to put the patient's mouth to put it? That's another issue. Okay, there's one thing and another, but it is also I'll add it in some situations. So I will not read that. Okay, I agree with you. It's also an edge. Drug that can dissolve. She's she's not confident in what she's saying. No problem. Okay. You guys are missing. I want someone to say it. There's not something you are missing. Very important. If I say it now, you shout. If I say it now, you shout. What of drugs that are destroyed in the by the gastric juice? Who said it? Can you? Irritation, the itch. She said drug that irritate the gastric motor. I'm talking about the drug that will destroy by the gastric juice. Remember, right? Yeah, there are some that once they go, that's why you have enteric coated tablets. They will coat them so that they will jump the gastric juice, so that they will now go to the intestine and do what? Dissolve and release their active what? Ingredients to bypass the gastric system. So that can also help to bypass it. True of us? Okay. Good. Now, so okay, apart from we have listed about 7 points. I hope you know. Don't play. Okay, all this is you will call it you don't be putting it down. Okay, now they play. They play. Once I say I agree with you, it's correct. You put it down. Okay, you play this child. Don't play. No, yeah. In addition to those ones, listen to what other ones I want to mention. Of course, sublingual can be self-administered. True or false? Buccal, sublingual, they can be self-administered. Do you agree with me? Yes. They can be self-administered. Of course, they have rapid absorption because of what? This area is well venated. Okay, let me not use big grammar. Is rich in blood vessels. Okay, veins, they are rich in what? Blood vessels and supply of just they are rich in blood vessels. So because of that, now they can easily be absorbed rapidly. They are rapidly what? Absorbed. Of course, if the bypass, of course, in all, bypassing the first pass metabolism, bypassing destruction in the gastric juice, mainly geared towards increasing the what? True of us. So, of course, we have discussed that the first pass effect, there's no first pass effect at all, because they have no business with the what? Liver. It has no business with the liver. So there's no first pass effect at all. Because of that, there's higher bioavailability, at least to the normal bioavailability that you should have for the what? Drug. Then, do you know why? Do you know why? Do you know why there in the mouth? Do you know why there? They cannot be destroyed by most of by the juice the they cannot be destroyed there around the buccal cavity to compare with when the drug enters the water stomach. Do you know? You know, remember I told you that in the stomach, the gastric juice can do what? Destroy some drugs. And that's why some drugs can also be administered sublingually or buccal or through buccal routes. I told you, do you know? I asked, do you know why they are not destroyed there to compare with when they enter the what, stomach? Because of the pH. Because of the what? The pH. So the pH here to compare with the pH of the what? Stomach. Of course, that stomach is acidic. True of us? True of us? Is it acidic or neutral? Now, but that one is relatively closer to neutral when compared with the what? The pH of the what? So that place, it will be safer to be administered through that route than what? Through the what? So just know that point. It helps you to understand what you are saying. Okay. Now, this cannot go without an issue. It cannot go without an issue on its own. So, because nothing is perfect, okay? Nothing is what? Perfect. That's why you have different routes, so that if this one doesn't work, this one will do what? Work. Now, what are the limitations, disadvantages, or what have you? What are they? Can you share with me? What do you think? What do you think may be an issue with this?
They are not still for that is
That what? You go far. God bless you. God bless you. Drugs with unpleasant what? Tests. You in fact you don't like it. You don't like it at all. Drugs with unpleasant tests. So after you using the first dose, the patient will run away. Except those on their own naturally. I don't know how that happens. There are people on their own naturally. They don't know what is bitterness. There are people like that. They don't know what is bitterness. If you study the tongue very well, I don't want to go into that. If you study the tongue very well, it's from the tongue. The depth of things, if you go into the tongue, there are a lot of things about the bitter test, bitter herb. So let's not go there. But there are patients like there are people like that. They don't like even using water for drugs. They chew it and go and please give it to me. You put it in the water, I'm chewing and be going. So there are people like that. So except such, but in general, patient will never try it again. Now, another limitation. Another limitation. Share with me. Let's see. What do you think? There can still be irritation of the what mucous membrane there. Yes. You know that the mucous membrane is easily irritated. Mucous membrane is easily what? Irritated. So there can also be what? Irritation of the mucous membrane around the area. Any other one? Unconscious patient. I didn't say so. Even if the patient mouth, yes, it's unconscious, but if you cannot open its mouth, what are you doing? You cannot enter now, so you cannot work for such patients. If the patient, you cannot open the patient's mouth. Are there unconscious person? Are there unconscious person you can open their mouth? Are there? Someone said no. Are there unconscious persons you can open their mouth? Are there unconscious persons you can open their mouth? Are there? Infant may not have what it takes to keep it there. They may not have what it takes to keep it there. That's my issues, nothing else. Can you hold the tongue? Can you hold the tongue against it and stay? Can you hold the cheek against the gum? You say, as we are you brushing them, what they do with their toothpaste? Okay, you're trying to figure out something. I like that. Okay, you can put that. And except old infants. Okay, infant. Okay, do you know what an infant is? Who an infant is? What age? Great. No, there's no such old infants. I mean children, old children, adult children that if you tell them to do something, they will do it the way you tell them to do. Neonate income. Neonate. 1 year. Please. You just talking story. Each one must contribute. Whether it makes sense or not, she must contribute. I like that spirit, though. You see, all right. So, you can. I don't want to. We'll still discuss when we go into pediatric dosing. We discuss the neonate, infant, the age bracket, child, adolescent. Please let us waste our time there. Okay. One issue with this is that because of the nature of this area, only small amount of what or small doses of the drug can be what accommodated. Only small doses of drug can be what accommodated. Only small doses can be what accommodated easily without small dose DOSE size. Okay. You don't. Okay. You asking whether dose is the size. Okay. In fact, even if the tablet is big self, even if the tablet is big self, uh, tablet being big. I mean, if the tablet is small, you may not even hold it there. Two of us. But of course, when you say small dose, that doesn't mean that it should be tiny, very small, tiny. Am I communicating? The point there is that when you place it there at a time, because of the thing is sipping, unlike this stomach where you have a larger surface area. Two of us, the surface area there and there, which one is larger? So surface area here and there, which one is larger? Here, right? But if the tablet is too small, very small, it may slip off. True of us. Sometimes it may be. I think I have explained that, but let me just point it out. Sometimes it may be inconvenient to hold the what. I'm not sure that it's not convenient at all. Is it convenient? It's not convenient to hold the tablet there and there. They'll tell you just hold it there, leave it there. Is it convenient? It's not now. You cannot hear God bless you. If you gossip a lot, you cannot gossip. Enough Jesus passing. Because you want it to someone like Ijoma will have issues because she must talk. So if you put it there, giving to Ijoma is don't talk for the next 30 minutes. So it's not convenient. All right. Eh? Easily. Remember that the adverb there says a lot of things. Easily can be accommodated. I'm not saying that it is only that can be accommodated. Underline that easily there. I'm not saying that it's only small dose can be accommodated. What's the English? He said only. He said what? Only small can be accommodated easily. It may not be. It will be that easy to accommodate a large what dose. Am I communicating? Is it clear now? Good. Okay, so next one. Okay, now let's look at there are some drugs that are formulated, as sublingual tablet. I want to point one or two of them. But before then, let me see if there's anything I'm missing out. If there's anything I'm missing. I think I've pointed out everything I needed and needed to know. Now, drugs like isoprenaline, oxytocin, and formulated as what? Sublingual tablets. Isoprenaline, oxytocin. The commonest one is nitroglycerin, or you call it glyceryl trinitrate. Hope you can write all these things I'm calling. Yes. Good. One is isoprenaline, second is oxytocin, third is what? The commonest one is nitroglycerin, in brackets. Glyceryl what? Trinitrate. What? Trate. Then we also have buprenorphine. Okay, source to check. Check isoprenaline and buprenorphine if they're the same thing. Remember I told you that please, as you come to my class, come with your words. Make sure you have your data because I'm asking you, checking out a lot of things as in the hot. So someone should check isoprenaline if there is something. Isoprenaline and what? Buprenorphine. Check if there is something. While you check, let's continue. So nitroglycerin is used for what? Rapid. Please try to check the therapeutic use of all indications of all these drugs. Please, from today onward, listen carefully. Let me give you a clue on how to study. Please listen carefully. From today onwards, please, any drug you hear the name or you see in your course material or your lecturer mentions in class, please try, if you don't know anything about that drug, try to know the indication. Okay? Even if you don't know anything, even if you are too tired to lift your phone to browse, please try to know the words indication. Then you can try small and know the various dosage forms. Then you can try again I know different brands in the market. Then you can now decide to try finally. I know the strength. Then if you now want to rest, you now try to know the dosage. Am I communicating? It will help you. See, your knowledge of drug is not what you learn in a day. Every day, try to learn 1, 2, 3. Before 1, 2, 3 years, people are asking you what's going on. When did you learn all these things? It's because you are consistently trying to learn 1 or 2 drugs every day. Tell yourself, every day at least I should be able to know the pharmacology of one drug. If not anything, let me know pharmacology of one of a drug. You are taught, have you been taught, we are taught the how to discuss pharmacology of a drug? Eh? Don't worry, when we start drug classification and different drugs used in different disease situations, the first thing I'll do is to teach you how to answer, how to discuss pharmacology of a drug, the headings that you should list if you're asked to discuss pharmacology of a drug. Am I communicating? So please, those headings are what you should look out for in any drug you want to study. That's the meaning. So if of anything, every day look for one drug, try to study its pharmacology. There are 360 something 50, is it 60 or 50 days in a year? Eh? In a year. So if you pick one drug from different classes of drug and commonest drug you see around, and study their pharmacology, under 1 year you are studying pharmacology of up to 360 something drugs that you know very well. Before 3, 4 years, you will learn more, and the time will come safe, you become working MDEX. Okay, so let's continue. Okay, I said isoprenaline and buprenorphine. Norphine.
Increases sedation, and isoproterenol decreases sedation. Isoproterenol decreases sedation. Yeah, it's another name with isoprenaline.
Okay. They said it's another name for isoprenaline. So buprenorphine and isoprenaline, they work opposite. Is that what they're saying?
The other one decreases sedation. The other one decreases sedation.
Who else has something? Please, let's not just listen. We can discuss that one later. So let's just listen. Let me make the point I want to make here now. Apart from this one, okay, this nitroglycerin is used in what? Of course, you know that oxytocin is a hormonal drug. Then nifedipine can also be administered sublingually. Nifedipine, yes, is an antihypertensive. Nifedipine is an antihypertensive. It's used as emergency situation. Nifedipine, and yes, sublingually. It can also be administered like that. Uchechi knows what I'm talking about. She don't know. Uchechi. So she said, those things are making sense to you now, right? All those things you've been doing since, right? Good. I like that. Yeah, yes. It shock you? Yes, you can, but it can also be. It shock you? It shock you? And that's why you are here. You are here to be shocked. Because you start seeing, wow, so this has been happening, wow, all the time, wow, so this is what it is. Maybe you meet a drug somewhere, you say, wow, is that easy? Why? Okay, it's not shocking. Wow, yeah. And then it will start making sense to you. It will start making sense to you. Shay? Marvelous, Shay? All right, let's continue. So nifedipine is used in what? For treating hypertension in emergency situation. Okay? So it's given sublingually. or proper the one you swallowed. If you want, tomorrow you go and say, someone had a house, the the BP is very, very high, and you want to release crash the BP at least. You go and start giving person to swallow. In emergency situation, is what? Sublingually, okay? Sublingually. Now, let's look at the rectal route. Let's look at the rectal route. If you notice, see, if you want to understand this, if you want to understand all these things we've been discussing since, if you watch, each of these routes, I talk about brief, maybe talk. I've been discussing 3 things in each of them, up to 4 things. One is a kind of preamble, talk about what is useful, right? Then talk about the edge or what advantages, and then talk about the disadvantages. Then talk about different drugs or the dosage form that can be administered through this what route. In case I ask you to discuss any of these route of administration, don't go and be telling me long stories. Your point should be based on these 4 points. Talk about exactly so a kind of preamble, introduction, what it is, where if you say sublingual, where is that sublingual? Where is it located? If you say rectal, where is the rectum? Where is it located? This is what you talk about first. Then you talk about what advantages it has, right? Then to talk about what disadvantages. Then you now go to talk about what different drugs, dosage forms that can be administered you through that what route. If you give me that point, you get your mouth full. There are people that they will ask questions, they just will beating about the bush. Akorobago, Akoroba at the end. They may even run up to 3 pages, but they're nothing. You cannot make any point from what they wrote. Please, I'm giving you exam tips at the same time. If you know, you know. Okay, now let's look at rectal. Of course, you don't need to be told what rectal is, right? Through the where rectum, right? So of course you know where your rectum is. Your rectum is here, right? Where's the rectum? Here. All right. So rectal. What about this? In fact, with what we discussed in suppository, if you remember in our dispensing class, I was teaching dispensing, I was teaching pharmacology at the same time, I was teaching physiology at the same time. If you were following that lecture on suppository, I was teaching everything I had to do with, because you need to understand. I was even teaching anatomy and physiology, trying to explain, make it understand what that was. And I know even though it was dispensing class, we discussed a lot of things about different drugs, their clinical therapeutic uses in this. So I don't think we have any issue here. I don't think, even if we don't discuss it now, I don't think we have any issue here. Anybody that's failed any question from here, that person need to go to pharmacological prison and stay for like 5 months. Okay, now let's look at rectal routes. So of course, basically the drugs are administered basically as what? Suppository. True of us, as what? Suppository. Of course, you know what, I wouldn't want to start defining what suppository is again. We discussed it. Go back to your dispensing lecture. So suppository. Not only suppository, even enema. You know what enema is? See, it's not true. It's not true. It's not true. I mentioned enema, I discussed enema with you in a class. And when enema, why drugs are formulated as enema, what do you want to achieve? Didn't we talk about evacuation of bowel? So what's the problem? No, so human beings here are saying that we will not discuss it. Enema. So as enema liquid form, right? As a suppository what? So these two dosage forms can be administered through the what? Rectum. Okay? Through the what? Rectum. Okay, so now one thing I want you to know here is that I'm giving preamble now on rectal route. Hope you know. Have I said the advantage? I have not. Because where you are the rectum is, some say that their own is here, some say that their own is here. I don't know where your own is. My own is here, is behind here. Now, but the point is that we've talked about the location, right? Good. And also we're not talking about the what is it called? We also discussed one or two things on the drugs and the dosage forms, right? Suppository and what? Enema, right? Then another thing I want to point out is here, please, every route you are discussing, try to find out what you want to achieve. Is it systemic effect? Does it have systemic effect only, or local effect only, or does it have both local effect and what? Systemic effect. These rectal routes can have both what? Systemic and what? Local what? Effect. It can have both local and what? Systemic what? Effects. Remember when we discussed suppository, there's some suppository you like paracetamol for fever. Paracetamol can be formulated as suppository. Is it for local effect? Is it for local effect? It's for systemic effect. There have been a lot of drugs we discussed. Bisacodil, Ducolax, brand name. Ducolax is the brand name, right? I think that should be the innovator brand, if I'm not mistaken. Ducolax. We discussed it now. Yeah. Is it for local or systemic effect? And then, is it for local or systemic effects? Ducolax suppository, What do you want to achieve by even administering? What does it treat in the first place? So concentration. Is this a systemic? Can it be taken care of by systemic, or if you insert it, is it systemic or local? Explain why it's systemic. Badam. But what? Okay, what of anosol for hemorrhoids and the pile? Is it for local or systemic effect? Do you know why I'm not giving you the answers? We have discussed this. Oh yeah, tell me. Is it for local or systemic effect? Anosol, you insert. The suppository, yes. Is it for local or systemic effect? India. Okay, this is the type of question that you see in your OBJ. MCQ, PR. Go back to your material again. Go back to your note too. I'm not answering. I'm not giving you the answer. I can't keep spoon feeding you. It's wrong. Go back to what we discussed, please. All right. So the point I want to make here is that it has both what? Systemic and what? Local what? Effect. Now let's look at the advantages. The edge it has. That is, if there is any edge at all. That is, if it has any edge. Okay, let's look at it. Of course, if you want to run away from first pass effect, you can also administer the drug through the what? Rectal route, okay? Yes, it escaped first password effect. Okay? Good. So drugs that have first pass that is affected by first pass metabolism can be administered through what? Rectal route. Okay? Of course, the drug cannot be destroyed by the what? Enzyme. You know, there are a lot of enzymes even from the mouth to here. Hope you know. There are a lot of cascade of enzymes looking for who to devour. So the drug, if you start, it can escape the effect of these enzymes. True of us, you can escape it. Okay. So of course, for patients, for for whatsoever reason, for whatsoever reason, some patients cannot be able to do what? Swallow what? Take drug orally for some reasons. It may be that they are unconscious. It may be they are what? Unconscious. It may also be that they are uncooperating. They are conscious, but they are not. They are uncooperating. Maybe a child, you don't want to sit one place for injection. You don't want to sit one place, and you are afraid that if you want to inject, you may injure the baby, the child. True of us, you don't want to take the drug orally, and the drug is not even available topically, but it's available as suppository. You have no choice than to do what? Do it. He's a boy. Ah. Okay, he's talking about pastries. Okay. No, pastries. Yes, pastries is also a suppository. Hope you know. Are you aware? Pastry is also a suppository. It's a vaginal suppository. Hope you know. Yeah. So we are not talking about that one. We are talking about rectal suppository now. The one you put rectally. Okay. No, she's right. She's right because I said suppository, and I didn't mention the type of suppository. Oh, me look at more. And I can. How now? Don't we have urethral suppository? Have you forgotten? Urethral. It can enter through the penile opening now. And now, you urethral suppository. Yeah, that's what I say. But they assume they are different names, but they are also types of what? Suppository. Even though I don't think it's that common now. Okay, now, so uncooperating patient can be maybe onyala, a psychotic patient, onyala na mad person that you need to treat. You cannot. But if you can target the person, sooner the thing there. Am I communicating? So uncooperating patients, you can use what? Suppository. Okay. Then for a patient that is what? Nauseous and vomiting. So you can also use what? Suppository. Suppository to administer the drug you want to do what? To deliver the drug you want to do what? Deliver. Am I communicating? Nauseous, NAUSEOUS. NAUSEOUS, nauseous. Hope you know the meaning of nausea and vomiting. Nausea, hope you know the meaning. What is nausea? I'm asking you, check it up now, fast. How can I give you material you see some words you don't understand, you will not check it up? The feeling to vomit, right? Yeah. You go for God bless you. Vomiting is after vomiting. That way they go together. Nausea and vomiting, they always go together. Are you aware that you can nauseate without vomiting? Yes. So what are you saying? Is it clear now? You will still go far. You cannot say without vomiting. You must not vomit anytime you feel like vomiting. You may do it to go back. You keep starting your engine. and you may even end up not even vomiting. All right, let's continue. So let me see if there's anything I'm missing out. 'Cause I don't like missing any point at all. Have we talked about drugs that are unpalatable, right? Even drugs that are irritable, that may irritate the mucosa. True of us, you can administer it through what? Even though, anyway, when we go to the disadvantage, so in fact that is even the now here the main irritation. Remember processitis we discussed now. Rectal mucosa is easily irritated, but you may, if I don't know if you may want to run away from gastric irritation and go and cause another irritation in the rectum. The rectal on its own has its own issue with the what? Irritation. Then let's when we go to the disadvantage, we'll discuss that. Another point is this. You know, there are some patients, maybe because of surgical procedures, before and after surgical procedure, they don't do anything that will enter the word GIT. As in enter the what? The stomach. It's possible. So because of that now, you can also administer through the what? Rectal what? So what I mean is this. So before any surgical operation, there's always restriction about what enters here. Before most of the surgical operation, there's restriction about what enters there. Okay, in such patients, you can go through what rectal what route. I do not say not in all. In some surgical what procedures, you may not have to take in something. Am I complicated? You restrict what you take in before and what after. But you need this drug. What do we do? It can be administered through what? Rectal. That's the point I'm trying to make here. I think that's the point I was about missing. Now let's go to disadvantages. What do you think? You make up the disadvantages of this route. First one is what do you think? There's always the tendency, embarrassment. No, yes. It falls under the, generally some patients, don't like it. There are some people, maybe because of their belief. Remember, I think we discussed this in your what? In your dispensary, in your suppository. We discussed this now. As one under the disadvantages of what? Suppository. Two of us we discussed this here. Thank you. Thank you for bearing me with witness. So it makes the work easier for me. It's not true. There's always incomplete. Most times the absorption is incomplete and erratic. Incomplete and what? Erratic. I wait for someone that ask me what's erratic. Then there's high possibility of what? Rectal mucosa irritation. That one is always there. Most of the times, there's high probability of what? Rectal mucosa irritation or even inflammation. You can even proceed to what? Inflammation. What in that inflammation is called what? What? Processitis. Okay? Processitis. Okay. So let's that's the one we can take for now. Now let's look at different drugs cum dosage form that you can Of course, we have mentioned the dosage forms, right? Enema and what? Suppository, right? Mainly. So let's go to the drug itself. So drugs that can be administered rectally as follows. Paracetamol, I think I mentioned paracetamol, right? Paracetamol for fever, okay? Paracetamol, diazepam, good for seizures. Diazepam can be administered like that. Laxatives, that is where your bisacodyl comes in. Laxatives can be administered through what? Rectally. That's where bisacodyl comes in. Used for what? Constipation treatment, good. So, in fact, if you notice that, in fact, the best to take care of that, see, rectal mucosa irritation is serious. So, it's serious. So, if you notice that this drug, if you notice that a drug can irritate the rectal mucosa, please just administer it through injection. Don't bother yourself going through suppository what route, through rectal route. Okay. Okay, now, okay, even indomethacin can be indomethacin, aminophylline. What do you hear now? Yes. It shock you? Browse it now. And you see, do you know why I want you to be coming with your phone? Listen carefully. You are free. Any information I give you right here now, right here, you check it up. If it's correct, we move on. If it's not correct, you correct me. That's why I allow you to come with your phones and yeah. But I wouldn't want it to distract you when I'm explaining something. That's what the one I will not tolerate. Because I'll ask you a question. If you talk nonsense, I leave my class. You can check, but don't get carried away and lose what I'm saying. Okay? So, you saw it now? Yes. It's not meant for that though. It's an NSAID. Just like you have your aspirin, diclofenac. No one will discuss NSAID this semester. I'll teach you NSAID. I'll teach you analgesics and antipyretics. So I'll discuss an anti-inflammatory drugs. I'll discuss it today. You understand what NSAID? They have, these NSAIDs, they have this issue. I'm discussing now, so women are talking. Listen carefully. This NSAID, they have issues with what? Gastric mucosa. In fact, that's why ulcer patients. So all those rats, their this is not as strong. So if he gets their gastric mucosa, it will scatter it. That's why it kills them. Is it clear now? That's why it's killed. Unlike human being, our own is strong, and those one you scatter. If you get that's what they use it as rat poison. Not that it's meant for rats. If they use what it does to the what intestine, the gastric to the GIT, they now use it against innocent rats. So that when they get there, they just scatter everything, they just die. So people know people know it as Indoseed now, brand name here. People know it more as rat, but it's not for rats. It's an NSAID, okay? All right. So I say that indomethacin and aminophylline can also be do what? Administered rectally for systemic effects. It's still shocking her up to now. I told that you are here to be shocked. It's not. Okay, now let's continue. More shocks are coming. What you never knew that was existing before. or was true before will now become clear to you now. Now, so the next one, okay, I've mentioned Bisacodi, right? I've mentioned glycerin, right, for local effects. Now, this is the much we can take on rectal routes. This is the much we can take. This lecture should end by what time?
9:30.
What do you have by 8:30? By your timetable, what do you have 8:30? By 9:30. Okay, we have free period 8:30 to 9:30. See, by the time first year is coming, you may not be seeing me like that. So I know what I'm doing. By the time they come in, they will divide my time. I'll divide your time with them and you. So I want us to cover from now till September, July, for now till August. Beginning of fiscal season, I want us to cover as much as possible, so that by the time they come, what do I do with you now? Tell me, just tell me. Be fair and just. Don't be partial, be impartial. Tell me what I do with you now. No, tell me exactly what I do with you. Just be sincere, tell me. No, you're not being fair. Even though you are fair, but you're not being fair. She always have points to give you. She always say her mind. And she's still talking. Go and sit down. See, the idea of this is not about, see, I want you guys to understand something. It's not about writing your name. It's not about punishment. It's not about paying money. It's about missing out things that'll help you, and I'll help the society. If you attend your lectures and learn these things, the society will be a better place to be. For real. You'll be safe. Tomorrow, patient will be patient people's life. See, if you don't know who you are, let me now put it to you now. Other health professionals, it's a health team. I'm not talking down on anybody. Put me anywhere. Other health professionals, we are all work together. But if they make any mistake, a patient may die. That is, if someone must die out of the mistake, maybe a patient may die. But if you make any mistake as a pharmacist, as a pharmacy technician, if you make any mistake, a lot of people are going. The first thing in the profession is discipline. I'm not, even up till now, I am still disciplining myself, no matter the level I have attained. Because human nature wanted the easiest way, the soft way. Human body, you want to sleep, you want to rest. It's you that will discipline yourself. Tell yourself, no. What's time now? I've been awake since 11 p.m. Till now, I've not slept. Till now. Yes, I'm wicked now. I am a very wicked man. Yes, I'm a very wicked man. I don't send you. Do the right thing. Yes. No. You know, we have different definitions of wickedness. Out of our selfishness, out of us wanting things to be done the way we want it, you become wicked. When you don't do things the way I want it, you become wicked. Yeah, people have different definitions of wickedness, and you are entitled to your own opinion. That's why when you say I'm wicked, I say yes, I'm a wicked man. I don't send you. Do the right thing. That's my business with you. Are we together? Do the right thing. I don't know what you meant. So, what point am I trying to make? The point there is that you should be in class by 8:30, 7:30, as case may be. Why will you be awake? Plan yourself well. When you are done with what you are doing for the day, what are you wasting time? Go early and sleep. Go and rest. You can wake up. You can wake up 2 a.m. Stand up and prepare yourself. Prepare for lectures. Before 7 a.m. I was here because I had already prepared for this class. But your host is sleeping. After sleeping, you come here late. No, which I'm trying to explain something. Listen carefully. Listen carefully. You see. Listen carefully. This is also part of the training. You train yourself. I'm not saying you should not sleep, but plan, whether you sleep in the evening, sleep. The point that in a day you take your what? Make sure you take up to your 6 hours sleep or 7. That one is sacrosanct. Are we together? Good. But you know that you should be early. Why will you stay late? I don't know what you're doing. Why will you stay late and sleeping by 12 only to wake up late and start coming late to your class where you sit down to learn? Why not sleep earlier? So you can wake up, prepare yourself for your lectures, press your school uniform, put everything in order. There's always light now in the night very well. True of us? Yes. Unless you have issues with your light in the hostel. I don't know, but there's light. You know, I live close, so I know what I'm saying. Okay, I will not tell you where I live. Am I competing? So please, let's come back to what I'm discussing. It's also part of the training. That's why I take some time to talk about this. These are some things you not see in any textbook. I share with you so that you help you to know how to plan yourself. The issue is that most of you don't plan yourself. You just after the day you just go and sleep. Anything that comes out tomorrow morning, that's what it is. No, you should plan your day. Know what you are doing. Plan yourself. If you are the type that don't wake up early before you sleep, make sure that your school uniform, your shoe, everything you need for the next class is intact. Then go and sleep. So that even if you wake up, let's say 5 or 6, or after 6, you can easily come to class on time. Just to go and bathe and come to class. So please, you have no reason for coming late to class. You have no reason whatsoever. No reason whatsoever. So I think I will stop here, right?
Yes, sir.
Today we discussed. We are done with enteral routes, right?
Yes.
We are done with enteral routes. So we will go over in the next class. We'll go over to parenteral. It may not be that. Okay. It may, where we have detailed explanation is in local. Parenteral may not have much explanation. So what do you okay? You say you have your PAC. Your next class is what? PAC, right? Do we have farm card today in our timetable? No. We don't have farm card today. Do you know what happened? I came in here thinking that I've already conditioned my mind that I would teach AUM after I enter farm card. So I forgot that farm card is not today. So that what happened. So if you want me to teach farm card, I will teach. If you don't want, I will go. PAC is primary health care. PSCM. Huh? I can't hear you. After, I should go, hello? If I live here, I will not come back again. If you say I should not come, I may not, because I have other people I teach now. I may not come back here again. That's why if I'm here, I'll just finish it. I will just give like 30 minutes break, then finish before going. And the other meetings may take my attention too. So it's okay. If you it's not in your timetable. You know me now. So if it's your timetable, I'll teach. If you like, let's say you don't know, it's your business. But this one, I know that it's not your timetable. That's why I'm asking you if you want me to do it. If you don't want me to do it, I will go. But the earlier we cover. Look at me. Listen carefully. I want you to know this. I have sent you the course outline. I have sent you the course material. Listen carefully so you understand what you make your choices well. I have sent you the course outline. I have sent you the course materials. I have sent you revision questions. Do you know what it means? I'm done with you. What it means that I'm done with you. If you like, be playing. If I come to class, tell me to go, I will go. Don't call me. I will stay. Exam. That 11 topics must be covered. Go and ask question. That's why sometimes I'll ask you. You say, no, go, don't teach. Go, sir, go. I will go. If you are wise, tell me to stay and teach. That's why I say it to them. Ask them, did you know why I say so? A time will come, you start looking for me, I'll be in one meeting or the other. And the questions, all the topics must be. And I remind you when you are chasing me away from your class. Yes, it's true. I do it. I remind you when I was begging you, say, sir, go, don't teach. I will go, it's your choice. So make your choices right. All right, thank you very much.
Thank you, sir.
Remember, our quiz is when? Friday. We are writing both FarmCalc and AUM simultaneously. That Friday. Please stop. Don't waste time. If I go now, I'll start hearing noise. Will start. Don't waste your time. Study. Do not play. Study. All right. Thank you very much for your attention. God bless you. See you next time.
Have a nice day.